You know, that's another thing that we don't really talk about. You don't have to own your own private practice to be an entrepreneur in this chiropractic realm. The reason that I mention that is because that's kind of the realm that I'm playing with right now. And it's extremely profound because I'm seeing non-chiropractors want to get into the chiropractic entrepreneurship realm because they see it's lucrative, because they understand numbers, they understand healthcare. A lot of times chiropractors have a level of uniqueness that's a little bit resistant to consistency and collaboration. And I think that has been a detriment to our profession, unfortunately. And as unique as we are as individuals, it's very important to have a unified voice, like Ben said, with the idea of collaborating and having mutual respect for each other. I'm learning that what has to come before respect is that clarity or that decision of what we are trying to accomplish. If we don't know what we're trying to accomplish, we're all going to be trying to accomplish a similar goal or different goals on our own. And that's what's kind of taken the chiropractic in this little tailspin of not really making progress in the 125 years that it's been around. But we have opportunities to do that, and podcasts like this talking about this prior to getting into school or prior to having these experiences is very important because above all, we have to have respect in a direction.
Yes, and I believe there's opportunities that most students are not aware of. If you are interested in a specific technique, recognize that there's other schools with students interested in that same technique that are gaining access to different resources that would help you in your path. And so what you're describing with the direction you're going and getting involved with this franchise model and really trying to, I believe what you're trying to do is make sure you've got your finger on the pulse of how the profession's being marketed, what the messaging of the profession is, and also the systems and procedures in these franchise clinics are so crucial so that the general public is able to really get a continuity, get a consistency in their experiences. If they recommend their friend goes to the chiropractor, they're going to go to have an experience at this franchise that's similar to the experience they had because there's continuity there. I know that for me, one of the most sort of eye-opening things before I went to chiropractic school, this chiropractor in his seminar said, raise your hand if you feel comfortable referring to the chiropractor in your white page, like close your eyes, point to a random chiropractor. How many of you would refer to that chiropractor if you didn't know them? And nobody has trust. And so I believe what you're describing is we need to develop a clear picture of what's being offered and what the offerings are, so that students can really come together, the profession can come together and just be on the same page somewhat. You know, even if we want to do it in different ways, at least we're clearly moving towards the same goal. You know, there's very few healthcare professions that have multiple different political organizations that are representing the values and the vision for the profession. Exactly. So we're hoping that we can bring more people in that are from inner city communities because I think that there's like very few differences between chiropractic and the barbershop model, like a chiropractic model where the community comes together. People know that they can go there and be in a safe space where they see people they're familiar with, where they can have meaningful conversations and really learn. Like the youngins are getting schooled when they're at the barbershop, just like when young people come to the chiropractor. Yesterday, I had a young man come in, 15 years old. He's been getting homeschooled, but he also grew up with parents who are from, you know, deep East Oakland, which is where I live. And he was looking at what I was doing almost like Marvel superhero. You know, he's really into the old martial arts movies, and he sees the parallels between chiropractic and that application with martial arts, which he's really interested in. So I believe that, like you said, chiropractic could be made into so many different versions of itself based on who we're talking to. But the message needs to be consistent. And that's something that I really appreciate what you're talking about doing. To talk to the chiropractic entrepreneurship piece, yes, from my perspective, the model that I'm trying to promote to pre-chiro students is to think of a chiropractor as being made up of a scientist, a thinker, an artist, a teacher, and an entrepreneur. And I believe it's very valuable to start to see yourself as an entrepreneur early on. I'm encouraging prospective students to start their own business even, or
Mm-hmm.
get involved in an entrepreneurial venture.
Yeah.
So I can see there being a connection point between these franchises that you discussed and prospective students, where we can develop a clear role and responsibility. I also have a person I'm taking care of now who's a pre-PT student. And in pre-PT, you're required to do a certain number of hours in a physical therapy clinic.
Yeah.
And so I see the company you're working with is being able to develop a model where we can bring prospective students in and give them a job that they can learn. They can learn the back end and the front end
Yeah,
through
exactly.
experience, of course.
Yeah. Yeah. Yeah, you said a lot of great things, man. And you're right. It's just a matter, you hit the nail on the head in regards to what I'm doing, why I'm trying to do it. You mentioned the barbershop and this idea of community. I think that's what it needs to be. They need to be everywhere. They need to be a safe space. And we need to just make sure that we're making this accessible to everybody, but we can't make it accessible without adequate education. Everybody knows they need a haircut just because that's just how we've been raised and it's aesthetically pleasing. Everybody doesn't know they need to get their spine checked and adjusted when necessary, you know. So we have to really start to portray value for that, so it's as regular as going to get that weekly haircut.